right, so I always like to begin with a little bit of energy. So when I say knowing, you say matters. Knowing matters. Knowing matters. Knowing matters. Knowing matters. All right. Good morning, everyone. My name is City Council Member Pierina Sanchez, and I am the proud sponsor of 895, which we will discuss today. The first National HIV/AIDS Awareness Day was marked in 1999 as a grassroots education effort to raise awareness about HIV and AIDS prevention, care, and treatment in communities of color. It is the same year that the Black AIDS Institute was created to end HIV in Black communities. 21 years later, we continue to gather to highlight the progress of HIV testing, prevention, and treatment efforts, as well as consider the ongoing challenges to reducing HIV among Black and African people in the United States. In 2023, living a full life with HIV is normal due to advances in medicine, provided that you have access to the necessary education, treatment, and care. And yet, by any measure, appalling HIV and sexually transmitted infection inequities persist along racial, ethnic, economic, gender identity, and sexual identity lines. A few statistics. In 2016, the CDC reported that 1 in 11 white men who have sex with men would receive a positive HIV diagnosis in their lifetime. That needs to get to 0. For Latinos, 1 in 4 men who have sex with men would have a positive diagnosis in their lifetime. And for Black men who have sex with men, that diagnosis rate would be 1 in 2. Wow. And this is according to the CDC. In 2019, we see this worsening when examining transgender and gender nonconforming, gender expansive people. As globally, trans feminine people are 66 times more likely than the general population to receive an HIV diagnosis. Trans masculine people are 7 times more likely than the general population. In 2019, Black trans people are 3 times more likely to be diagnosed with HIV than trans people of color of other races and ethnicities. And Black trans women are over 6 times more likely than white trans women to be diagnosed with HIV. Sorry, Black trans. In 2021, getting to my hood, the Bronx has over 23,500 people living with HIV. This is more than 3 times higher than the overall New York State rate and the highest within New York City, with rates more than double those of Brooklyn, Queens, and Staten Island. In 2021, the Bronx also had the highest rates of HIV and AIDS deaths. These rates are most alarming among Black non-Hispanic Bronxites, who are diagnosed with rates of HIV at over twice the rate of their white and Hispanic counterparts, experiencing the majority of HIV and AIDS deaths in our borough. In New York City, while overall rates of gonorrhea and chlamydia have decreased, infection rates for both STIs disproportionately affect people living in very high poverty neighborhoods, defined as 30 to 100% below the federal poverty level, with case rates approximately 3 times higher than rates for people living in low poverty neighborhoods. This is an issue of race, ethnicity, class, wealth. These inequities are alarming to anyone who is paying any attention. And importantly, they persist despite over a decade of research from leading HIV researchers that clearly shows that Black people are less likely to engage in risky sex than their white counterparts. Yeah. The reality is that this is proven. I will say it again. HIV researchers are clearly demonstrating that Black people are less likely to engage in risky sex than their white counterparts. The reality is that the disproportionate impact of HIV in Black America cannot be separated from the long history of anti-Black racism in this country. The same forces that render Black Americans vulnerable to poverty, unemployment, limited educational opportunities, incarceration, voter suppression, housing instability, All of these are the same forces that have made the HIV crisis, much worse in our communities. Thus, to end HIV and AIDS, we must end the systems and practices that undermine, disempower, and harm Black individuals and communities. These individuals and communities who need testing and treatment confront major obstacles to access, effective use, and receiving the support that they need to prosper. Two more statistics. Black and brown communities are less likely to be connected with ART, antiretroviral treatment, which is 100% effective at preventing the spread of HIV. And they have limited access to PrEP, pre-exposure prophylaxis, which is also extremely effective in preventing HIV positivity in the first place. January 30th, 2023, the CDC released its National HIV Behavioral Surveillance Report just 2 weeks ago. 50% of white men are accessing PrEP, 44% of Hispanic and Latinos, and 24% of Black, gay, and bisexual men who aren't living with HIV used PrEP last year. So, what do we do about this? We fight on. We fight on to address the systemic inequities that are facing Black Americans all across this nation. And in the City Council, a small step, but a meaningful step. Intro 895 would require the Department of Health and Mental Hygiene to ensure accessibility to rapid testing for sexually transmitted infections in all boroughs, prioritizing communities in boroughs that have higher infection rates. This bill would also require DOHMH to conduct education and outreach campaigns within communities. We have to remove the stigma, even as we educate and empower our communities. So let us recommit ourselves to addressing the disparities, the inequities, and dismantling the barriers that prevent Black people from receiving the health care they deserve, regardless of how they identify, who they love, or where they live. I am so honored to be joined by colleagues, the public advocate of New York City, Javani Williams, City Council members Lynn Shulman, who chairs the Health Committee, Councilmember Narcisse, Councilmember Joseph, Councilmember Bodger, Councilmember Bennett, the co-chair of our LGBTQ caucus, Councilmember Kavan, okay. And then also such a great number of organizations, including the National Black Leadership Commission on Health, Latino Commission on AIDS, Housing Works, Health People, the Alliance for Positive Change, the New York City Anti-Violence Project, African Services Committee, and the Caribbean Equality Project. So thank you all so much for being here today. I would be remiss if I did not completely shout out somebody who in my team has been critical to this effort, Kadeem Robinson. Thank you. Our legislative and communications director, and just all around incredible human being. I did steal them from the public advocate. Okay, so now you're going to hear from many critical voices in this fight, in this initiative, folks that have done so much work to get us to the positive place that we are now, and who will continue to fight. So first up, I'm gonna bring up the public advocate, and then I'll bring up some colleagues and some organizations.
Thank you. Thank you. Peace and blessings, love and light to everyone. I'm very honored to be here, Councilmember Sanchez. First of all, I want to say thank you to the diversity that we have in allies, especially support issues. So thank you so much. And I'm happy to be here with my colleagues. And I do want to make sure I shout out someone who is paving the way, particularly for Black women, but people in general. Former President Virginia Fields. It's very important. Thank you so much. Today is Black HIV Awareness Day. And I'm glad that we have made so much progress as a city and a nation over the last several decades in combating HIV and AIDS. I think people need to be made aware of some sobering statistics from 2018. Some of you may have heard. Although they represent only 12% of the U.S. population, Black people account for a much larger share of HIV diagnosis, 43%. People estimated to be living with HIV disease, 42%, and deaths among people with HIV, 44%, more than any other racial ethnic group in the United States. Today, there are more than 1.1 million people living with HIV/AIDS in the United States, including 476,100 who are Black. HIV death rates death which HIV is indicated as the leading cause of death, are highest among Black people. Just like with COVID-19 pandemic, there was a disparate impact of this virus racially and geographically. And these disparities extend to many other sexually transmitted infections, or STIs. The first step toward combating these illnesses is testing. The past World AIDS Day, testing was highlighted as the key to ending HIV and doing so with equity. That's why I'm very proud to be here partnering with Councilmember Sanchez on our bill, Intro 895, to expand and guarantee the presence of rapid testing sites in neighborhoods across our city. Critically, the bill also requires the city to prioritize areas with the highest rates of infection and transmission, combating the disease and the disparity at the same time. We have to be okay with talking about race and how things impact race. We often talk about the problems in terms of race, so we have to talk about the solutions in terms of race as well, so we can get the solutions and the tools needed to the people who need it the most. Lastly, and here's something we can start on right now with this press conference. This bill mandates an education and information campaign to inform communities about the need for and availability of testing. I hope everyone watching and listening to this press conference today or reading about it tomorrow knows that rapid testing is accessible and is essential for both individual and community health. In addition to the many medical processes and treatments, we need to reduce the stigma and barriers to mental health and social support for adults with HIV. Fighting that unjust stigma will encourage people to get tested, know their status, and if necessary, get treated. With the amount of free and low-cost support services available, every New Yorker can know and should know their HIV status. I'm so glad that people with HIV can live long and healthy lives, but our systems have to catch up to science so that just as we can detect and diagnose early, we can support people throughout their lives. Even as we progress, even as progress is being made to combat the virus, people of more color and those in the LGBTQ+ community in our city are disproportionately affected with the virus. And we must increase our efforts at prevention and support in these services. Communities, including by expanding access to life-saving medications. It is clear that we have made significant strides in our worldwide struggle to eradicate HIV and AIDS. It is just as clear that we still have so much more to go toward beating this illness. The crisis remains real, pressing, immediate, and devastating after decades of that fight. Information is a crucial component in the fight, and is a fight we can win. Very often, when we hear people talking about the crisis is over, or we've moved past the crisis, they're talking about very specific demographics. And when you dig down deep in it, the people who have been suffering the most, that crisis rages on. That is the case here with HIV and AIDS, the Black community in particular, and the immigrant community in particular. The crisis is not over, so we should not pretend that it is. We should move forward with force and speed that we always have when all demographics were suffering. Let's pretend, at least, that everybody's life is equal to everybody else's. People who are wealthier, people who are whiter, often have access before everyone else. And when the crisis gets less in their communities, we act as if the crisis is over. And it is not. Lastly, as a person of faith and a person from a Caribbean background, it is important that these two communities break down the stigma of HIV, allow LGBT community plus to live healthy lives in the open. Because when we stigmatize these things, people die. People are not able to live their fullest lives. So as a member of both those communities, we have a lot more work to do to help eradicate this disease. Thank you so much.
Yeah. When I say knowing, you say matter. Knowing
matters.
Knowing
matters.
Knowing
matters.
Thank you so much. I'd also like to acknowledge that we're joined by the Women's Caucus today in the New York City Council, as well as Destination Tomorrow, and from my hood, Lawrence Heights Health Center. Thank you so much for being here.
Thank you.
So next up, I'm going to have a representative from Black Health. Please join me. Thank you so much for being here. Thank you.
Thank you. First of all, I'd like to thank the council members for bringing us together on National Black HIV/AIDS Awareness Day. The work that we do every day is an awareness day because HIV/AIDS is still rampant and it is disproportionately impacting Black and Latino population. Here we are over more than 3 decades of knowing about HIV. Still, there is no vaccine. And one of the things we call for is the same consistency, determination, and energy that we saw the government and pharmaceuticals putting together to come up with the COVID vaccine, which we all appreciate. But we cannot leave the need for a vaccine for AIDS to also be back on the drawing board. So I want to thank them. You've heard the statistics. I will not repeat them, but I will say there is so much more to do. We have to continue to make sure that our elected officials promote and support housing insecurity, income insecurity, and all of the social and political determinants that impact and drive HIV/AIDS. There's much we can do, and with this legislation that's being proposed, it is so critically important because the work that I now do, I'm still in public service, just at a different position. As the president and CEO of the National Black Leadership Commission on Health, Black Health, our mission is to promote the prevention of diseases and create equity and eliminate disparities within the Black African American community, and having rapid tests done on a regular basis as our outreach workers are out there, and some of them are here today with their signs. When they're out there, they're able to do rapid testing, and if there is a positive, to immediately refer a person for confirmatory of that test, and it has made a difference in the lives of so many. So I applaud you. I support your legislation. I commend you in anything that Black Health can do to continue to be a partner. Please count on us. Thank you, and God bless.
All right, thank you so much. We're also joined by the Ali Forney Center today, and I just want to be clear before I bring up the next speaker, and it is that we're not talking about changing behavior, right? This is not about behavior. This is about systems. We're changing systems, so we have to continue this fight to change systems. So next up, I want to bring up a representative from the Latino Commission on AIDS.
Good morning, everyone. Buenos dias. My name is Leandro Rodriguez. I'm the Vice President for the Latino Commission on AIDS. On behalf of the Latino Commission on AIDS, we would like to thank Councilmember Sanchez and the rest of the council members who supported this bill, as we need more progressive and equitable health care for our most vulnerable. Access to rapid sexually transmitted and HIV disease testing is necessary in saving lives and eradicating the stigma that still lingers in our society. Ensuring rapid testing is available and accessible in all our neighborhoods speaks to the vision and commitment of the City Council in keeping New Yorkers safe and healthy. Así que en nombre de la Comisión Latina, le damos las gracias a la concejal Sánchez en dirigir una iniciativa como esta, en donde se asegura el acceso equitativo a pruebas rápidas de infección de transmisión sexual. Estas pruebas rápidas salvan vidas, particularmente de las poblaciones más vulnerables. Y propuestas como estas aseguran que el estigma latente asociado a las infecciones de transmisión sexual sean erradicados, y demuestra el gran compromiso y la visión de los concejales en mantener a los neoyorquinos seguros y saludables. Muchas gracias. Thank you.
Muchísimas gracias. So next up, I'd like to call up our co-chair of the Council's LGBTQ caucus, Tiffany Caban.
Good morning, y'all. In honor of standing here, thank you for all that you do. My name is Tiffany Caban, council member of the 22nd District of AIDS, co-chair of the caucus, as mentioned by my colleague, and also chair of the Committee on Women and Gender Equity. And when we started that work, we said in both spaces that we were going to put Black women first, that we were going to put Black trans women first, that we were going to put Black femmes first, that we were going to put Black gender non-conforming folks first. Not only to right an uncountable amount of historic wrongs, not only because it is what we deserve, as human beings, but also because it is the key to building out the communities and the world that we deserve to live in. Period. That's it. Full stop. So I'm super grateful to my colleague, Councilmember Sanchez, for taking this step. You said something that I really want to reiterate around misinformation about risky behavior and all kinds of other things that gets thrown onto our communities, Black and brown communities, but particularly Black queer folks. Historically, we have been the folks who have had to do education. We are the community over decades that has modeled for everybody else what destigmatization looks like, how it saves lives, how we communicate with one another. And it is the government and other communities that have been lagging behind. And so that's where the work has to happen, to catch up with the person-to-person relational, organizing, grassroots efforts that our communities have done to keep each other alive. So again, I want to also in that spirit thank particularly Black queer organizers in this space who have saved a number of lives we will never know. So thank you. I'm not going to reiterate the statistics that were here before. We know who this disproportionately affects. This is a step in the right direction. Super proud to have the caucus be sponsoring it. Really proud to stand alongside all of y'all. We're going to get this done. It's going to pass, and then we're going to add to it. Woo! Thank you.
Yes. Amazing. So speaking of impacted persons and communities, groups that are reaching those that we need to be reaching with this work, I want to bring up Amanda from the African Services Committee.
Good morning, everyone. My name's Amanda Lugg, and I'm the Executive Director of African Services Committee. African Services is based in Harlem. We serve the African immigrant community of New York. Many of our programs address the diagnosis, care, and treatment for immigrants of African descent who suffer HIV infection rates at 6 times higher than the national average and face the highest average chronic hepatitis B rates across the country. On this day, when we recognize HIV in Black communities, we must think of and remember all Black communities and increase awareness and attention to the health issues of HIV/AIDS in African immigrant and refugee populations within the United States, and address the distinct factors influencing the unacceptable high rates of HIV in our communities by engaging testing and treatment, and address the distinct factors influencing the unacceptable high rates of HIV. This can only be achieved in a culturally and linguistically appropriate frame as we strive to eliminate the pervasive stigma surrounding HIV in our immigrant communities by encouraging testing and treatment and empower our community members. Empower our community members to take charge of their own health without fear of cost, without fear of oftentimes perceived threat of negative immigration consequences. And Intro 895 will help facilitate these goals. And this is why African Services wholeheartedly supports its passage through the Council. Thanks, Councilmember Sanchez and your colleagues for supporting, because we can do better. We must do better. Thank you.
Thank you so much, Amanda. Now I want to bring up my colleague, the chair of the Health Committee, Councilmember Lynn Schulman.
Thank you very much.
Need you, Lynn.
I'm Lynn Schulman, and I am the chair of the Health Committee. Before I start, I want to give a shout out to the Caribbean Equality Project, which is part of my district, part of my new district. And I am someone who, not only am I an out lesbian, but I am someone who worked at gay men's health crisis in the early 2000s. And I remember us doing a lot of services around National Black HIV/AIDS Awareness Day. And I will tell you that a lot of the clients that came there were from the Bronx and from Brooklyn. And so this is really important. Healthcare is a human right. Healthcare is what?
Human right.
But it's not a human right if we don't have basic medical services like testing, like sexual clinics, because some of those clinics have closed in the last few years, like going into communities where this is so important, and HIV, and I've seen it firsthand, HIV and AIDS is particularly predominant in Black and brown communities, and we need to make sure that the services that we have in the city go to marginalized areas where they're needed, You know, there was a public perception back when I was at Gay Men's Health Crisis that HIV and AIDS was only in white gay men. That is not true, not true. And there were Black women, there were Black men, there were brown men and brown women and non-binary who were getting HIV and AIDS, and the stigma associated with it, and the mental health. And it's correct in what was said here before by my colleagues. It is not a risk behavior issue. It's an issue of having, you know, we have so many more services now. We have PrEP, we have medications. We need to make sure that people are tested, that they have access to these medications. You should all look at, there's a New York Times article today that talks about the pharmaceutical world and how people can't afford basic medications and things. That's really important to know. So we need to make sure that those who are marginalized, those who have HIV and AIDS are taken care of. I want to thank my colleague, Councilmember Sanchez, for putting together this bill, of which I am a proud co-sponsor of. And representation matters. Look at who's here today. Look at who's here today. We represent the council now, and we're going to get things like this done, and we're going to take care of everyone so that no matter what zip code that you live in, you get the medical care and services that you need and you deserve. Thank you.
Thank you so much. So next I want to call up the Caribbean Equality Project.
Good morning, everyone.
Good morning.
My name is Mohammed Q. Amin. I am the Executive Director of Caribbean Equality Project. We are a Caribbean LGBTQ immigrant rights organization based in New York City. The Afro and Indo-Caribbean LGBTQ immigrants community that Caribbean Equality Project serve face unique challenges, and health inequity should not be one of them. New York City is home to the largest Caribbean foreign-born population, many of whom who live in Caribbean-centric neighborhoods like Richmond Hill and South Ozone Park in Queens, Flatbush and Crown Heights in Brooklyn, and Castle Hill and Soundview in the Bronx. At least 40% of New Yorkers are foreign-born, and given the migration trends of LGBTQ individuals, an even higher percentage of LGBTQ community now composed of recent immigrants. Health services have always been a component of Caribbean Equality Project's advocacy work for the past 8 years, as LGBTQ immigrants from the Caribbean need specialized assistance in navigating NYC resources, and that includes HIV and STI testing and care. A further challenge is finding service providers that are culturally competent to serve LGBTQ immigrants. Intro 895 will close the gap in accessing sexual health and wellness resources in New York City. In 2015, we launched Knowing Matters, a sexual health and wellness campaign that has been breaking the silence about HIV and AIDS through public education, performing arts, and promoting prevention, while offering support and care to Caribbean LGBTQ communities living with HIV in New York City. According to a 2018 New York City Department of Health epidemiology research, the highest incidence of new HIV diagnoses are among foreign-born New Yorkers, and these folks were born in the Caribbean, including Dominican Republic, Jamaica, Haiti, and Guyana. Intro 897 will finally focus on the racial disparities in accessing health services that have long created inequalities in Black and brown immigrant communities. Your neighborhood, immigration status, socioeconomic background, race, sexual orientation, gender identity, and sex should not be barriers to accessing health services in New York City. Knowing your status matters, and it starts with getting tested. We have been living within colliding pandemics for decades.
Yeah.
If there is one thing we have learned from COVID-19, is that undocumented, low-income LGBTQ and immigrant communities are disproportionately impacted by health crises. But we know our elected officials have the power to create change. Today, I am calling Today I am reminding the City Council of your promise to protect all New Yorkers. Pass Intro 895 so we can love and protect each other. When I say knowing, you say matters. Knowing! Matters! Knowing! Matters! Knowing! Matters!
All right. Thank you so much. And just want to underscore that because it is our community. I'm from the Dominican Republic. You know, I'm from Haiti. And she's from Haiti. And we have Grenada, right? It is exactly our communities that don't want to talk about STIs. They don't want to talk about HIV, living with HIV. And it's okay. It's okay to talk about it because that's the way that we can protect each other. And I also want to talk about young girls, right? Young girls are facing some of the highest rates of STIs in our city. We have to talk about it because that's how we can protect one another. And so next up, I want to bring up the Ali Forney Center. And thank you so much for
Thank you, Councilmember Sanchez, for the opportunity to be here. First and foremost, thank you for introducing 895, providing rapid HIV and STI testing throughout New York City. For those not familiar with the Ali Forney Center, we're the nation's largest provider of shelter and wraparound services dedicated to lesbian, gay, bisexual, transgender, queer, and questioning youth. Last year, we had over 2,000 young people ages 16 to 24 access our services in New York City, half of which identify as Black. I'd like to take an opportunity to talk about our namesake, Ali Forney, who was a Black, queer, gender nonconforming youth who experienced homelessness in New York City in the 90s. 3 decades ago, Ali was advocating for safe sex for HIV prevention. In the past 3 decades, so much advancement has happened in research, in medical advancements for HIV/AIDS, but still there's a lot of work to do. Today, AFC relies on the trusting relationships that we build with our clients to be able to connect them to HIV and STI screening, testing, prevention, and care. We are super proud of the work that we do, the relationships that we form, and our success is largely based on the affirming healthcare counselors that we have that are certified for providing rapid HIV testing at our drop-in center. When barriers are eliminated, stigma is reduced, and access is increased, all New Yorkers are healthier, especially our LGBTQ plus youth. We know that to keep communities safe, it requires cooperation, collaboration across government officials, community leaders, healthcare agencies, partner agencies, and others. Thank you again, Councilmember Sanchez, for your leadership, for introducing and advocating for another vital tool in early detection, especially for the communities that need it the most. Thank you for the opportunity for speaking today, National Black HIV/AIDS Awareness Day.
Thank you. Thank you so much. So now I want to bring up a colleague who's been a nurse, who's been on the front lines in our health institutions. Councilmember Narcisse.
Good morning, everyone. I'm going to have to take you to a little journey of mine. When I work at Elmhurst Hospital, most nurses were scared in 1992, 1993 to touch an HIV patient. Guess what? I'm always dared to be the woman that dared to be different and not afraid. So I volunteer myself at Elmhurst Hospital to say I will take care of the HIV and AIDS patient. Because of what? If I was in that person's shoes, I would like the same thing. I would like somebody to treat me. I would like somebody to tell me that I'm here for you. After all, we became nurses for that. And I will tell you, some doctors were afraid. They will be standing outside the room and give me things, medication to take without talking to the patient, which is my job too. But they could have gone in the room, but they were afraid. Now, we're talking about how many decades after? We're still talking about testing in our Black and brown community. This is unbelievable. I cannot even imagine that we're talking about testing. We know that testing is one of the things that can bring the disease down, that will make sure that people stay alive. I want to say thank you to my colleague, Councilmember Sanchez and P.A. Williams for taking the step. Thank you. I'm with you. Infections rate for some, let's talk about it. I'm coming out. I want the world to know that we have to stop what we're doing, because there is no reason for some STDs, including gonorrhea, syphilis, have been rising for years. Last Last year, the rate of syphilis cases reached its highest since 1991, and we're talking about 2023. And the total number of cases hits its highest since 1948. HIV cases are also in the rise up to 16% last year. This is wrong. If the COVID pandemic taught us anything, it was a lesson in why testing matters. So let's bring the test out for everyone. Access to testing should not be for a group of folks. It should be for all of us, and especially in a high-risk community, like my community, like our peer refer. Some of our folks still think that we cannot talk about who we are, who we love. Let's say today we're coming out, and we want you to know that there's all kind of folks around us that choose the path they want to live. Now we have to accept it, and it is my child, your nephew, so let's not hide it. So let's come out and support. Lack of adequate testing will undoubtedly lead to public health crisis. And as a nurse, I'm going to tell you, we need to address it now, not later. It impacts our hospitals. If we're talking about the inequities, our hospitals are overloaded. Now we need to bring the test home to all the CBOs. Thank you for doing your work. Thank you for not giving up on us. Because when we are taking time, you take the front road, and you telling us we need to do just that, what we're supposed to do. Unfortunately, this crisis sounds all too familiar. Infection rates are highest among people of color. We heard it, and now we need to address it. And guess what? We cannot have access in our communities. And if I take my example, I don't have no healthcare center. I don't have any hospital in my own district. We lost so many lives with any pandemic, any epidemic. When you go to the high risk, what we call the color folks, the brown and black communities, we are the ones suffering. And I'm happy to see so many of my colleagues here. Therefore, I stand in full support of NSHOR 895 by Public Advocate Jomani Williams and my council member, Carolina Sanchez. DOH must prioritize access to everyone, and testing should be our #1 priority. So thank you all. And,
thank you so much. Knowing
matters.
Knowing
matters.
Knowing
matters.
Thank you so much. I now want to call up Councilmember Botcher.
Thank you so much. Tough act to follow. Hi everyone. First, I really want to thank Councilmember Sanchez and Public Advocate Williams. Thank you so much for bringing us together, your allyship. It is very, very good on this very important day. We have made a tremendous amount of progress in my lifetime on the issue of HIV and AIDS because of all the work of so many of the people behind us. But that has been uneven progress. 1 in 11 white gay men will have HIV in their lifetimes, but 1 out of 2 black gay men. That is shameful. That is shameful. And that is, at its core, anti-black racism at work. The administration of technology and medical advances has also been uneven. PrEP and PEP and testing. We have new and ever improving testing technology, and we have to make sure that it's available in all neighborhoods, especially in the most impacted neighborhoods. That's why I'm such a strong supporter of this legislation. Today, on this very important day, let's recommit ourselves to fighting HIV and AIDS and passing this bill. Thank you very much.
Thank you so much. Knowing
matters.
Knowing
matters.
Thank you so much. And it's such an important point, right? I'm here as an ally. When I was preparing with colleagues and friends for this press conference, I was nervous about it, right? Because what shoes do I stand in, you know? But that it's very important that we do this, right? Especially those of us who come from underrepresented communities or overrepresented when it comes to these scary and horrible statistics. So next, another ally I want to bring up, Councilmember Bennett. Thank you so much.
Great, thank you so much. First of all, I want to thank my colleague, Councilmember Sanchez, for her incredible leadership and our public advocates. On this important day, you've heard the statistics from so many of my colleagues about HIV transmission rates. It's unconscionable, these statistics. I want to talk for 1 minute about sexually transmitted diseases because the bill that my colleague, Councilmember Sanchez, is introducing, and I'm proud to co-sponsor, Intro 895, is literally going to save lives. By having rapid testing, particularly for Black and brown women, it is going to save lives. The rates of syphilis in the United States are higher for women than they were in 1948, and that has real-world health implications. Basically, you can become infertile if you have a sexually transmitted disease and you are not treated. So now a woman's right to give birth and to have a child is robbed from her. It also leads to higher rates if you have hepatitis B of liver cancer. Victims of hepatitis B who are not treated have a 25 to 40% higher chance of contracting liver cancer, which can kill you. So again, you are saving lives by having rapid testing, and it is just so incredibly important. And then lastly, cervical cancer. There are links to cervical cancer if you contract one of these sexually transmitted diseases, whether it's syphilis or gonorrhea, and you're not treated. So I really want to thank you for your leadership, and this is going to make a world of difference in so many people's lives and tackle these inequalities. Thank you.
Thank you. Thank you so much. So with that, we're at the end of our program, but it is an important day today to recommit ourselves, right? And as some have said, this is the daily work. This is the work that we do every day. But let us draw attention. You know, coming into this press conference, we posted about this on social media. We try to get the word out and are so happy at the turnout, but we also received hatred. We received hatred saying that HIV is not a Black issue, that there's no need to talk about race. Yes, there is need to talk about race. We're here to talk about it. We're here to be about it, to be about that change. And I want to thank everybody so much for coming out today. Thank you.